We begin our evening with a few remarks from the newly appointed Office of National Drug Control Policy Director, Gil Kerlikowske. Director Kerlikowske, we salute you for the new emphasis that you're placing on moving away from the divisive drug war rhetoric and focusing on getting help to those who really need it. Thank you very much for joining us.
First of all, thank you very much for inviting me. It's a great pleasure to be here. Ending the war was actually pretty easy. I didn't say we won. We have an awful lot of work to do. It's tremendous to be here amongst you and to talk about things other than law enforcement, to talk about the other parts of this whole system that are all needed to work together so that we can actually do a much better job in this country for a host of reasons. Saving lives, improving communities, and quite frankly, improving the economy. I want to mention a couple things. First of all, I was unfamiliar with Faces and Voices of Recovery, but thanks to a wonderful staff that we have at ONDCP, about 100 people who are very smart and very dedicated to making a difference in this, and certainly other people who have helped to educate me about a whole different side or the different parts of this as we kind of integrate this whole. Dr. Clark, Martha Gagne from our staff, and others. It's terrific. I want to congratulate the award winners too. They have a great acronym. In police work, we have everything has an acronym, SWAT and everything. This is the acronym PROACT, and wonderful for me to be here amongst all of these people. Let me also introduce a person that's fast becoming a good friend and was nominated by President Obama to be the deputy director of ONDCP. People in this room already have come up to me and said, that president really is very smart to nominate Dr. Tom McClellan. Tom is here with his wife Denny. I'm here with my wife Anna, who's way in the back. I did an interview with Rolling Stone magazine. We'll see how that goes. But I said to the reporter, I said, I think Tom and I are going to be the dynamic duo. I said, you have a police chief who appreciates and understands and is supportive of prevention and treatment, and you have a treatment icon who is essentially really supportive of the criminal justice system and the role the criminal justice system plays in treatment and recovery, and we're going to put a lot of renewed emphasis in the area of prevention. But let me mention a couple other things. The 21 million people who actually are in need of some level of intervention, and yet less than 10% actually receive that. The President's initiative called SBIRT that some of you know about, screening, diagnosis, and intervention, so that physicians in all areas, regardless of specialty, can be trained in, and when they talk to people, regardless of what they come in for, that they can also do an assessment. Because we know that if those doctors used to wear white coats, didn't they? Okay. Okay. We know that when those people in the white coats tell someone, you know, you actually need some help, or there's an intervention, if we do that early enough, we're going to save heartache and grief and lives and money. $29.1 million has been requested to expand that program. We know about the costs of incarceration. Certainly there are people that need to be in jail. Certainly there's a way of protecting society. We understand that. We are not saying that treatment and prevention is to the exclusion of enforcement or source country eradication or helping President Calderon do a much better job in Mexico. All these things have to work together, and they all have a part. But we know that incarceration is costly. We also, quite frankly, know that regardless, people that go into the jails and the prison systems, all but a very tiny handful get out. If they get out with the same problems that they went in with, well, Tom, you don't have to be a PhD to figure out that that probably isn't the best policy. We encourage these high cost to highlight the cost efficiency of providing a full array of treatment services. This organization certainly faces and voices of recovery as an incredibly diverse group, and the more that you can tell those stories, as I was just listening to, that recovery in fact is possible, the more that that message gets out there, I think the better off for all of us. The evidence supports the need for a continuum of care, and I can tell you that during my tenure as the director of ONDCP, I didn't wear the czar sash and all the other things that go along with it. Anna said I should leave that at home, but as the czarina, she's told me that I should actually work very hard to make sure that people understand the importance of all of these issues. And so, as a police chief and 36-year member of law enforcement, I'll be a strong advocate for making sure that President Obama's strategy, which will be rolled out after the first of the year, is comprehensive, is effective, and includes a full array of what's needed, not just what the war on drugs rhetoric told us, which essentially is the only tool in the toolbox is force when you talk about war. We're not at war with people, and we should figure out a way to do this. It includes tough law enforcement, but includes the other important services that you all so well represent here this evening. Thank you so much for inviting me. Thank you.
And I thank you, Director, for being here tonight and talking about the important issues, particularly the war on drugs, which is one of my favorites. The recovery community is here to support all the work that you're doing along with President Obama to expand the opportunities for people to recover. And we do thank you, particularly in your office, for the commitments and the many national organizations who are in this room joining us tonight.